Welcome to Indiana Newsdesk. I'm Joe Wren. Well, twice this week, the state expanded its criteria for who's eligible for the COVID-19 vaccine. Hoosiers who are 50 and older can now make appointments to get vaccinated. The state's health commissioner says by the middle of the month, she hopes anyone age 40 and above can start getting the shot. The Johnson & Johnson vaccine has been the game changer in Indiana. The state is getting about 54,000 doses of the Johnson & Johnson vaccine, and unlike the other approved vaccines, this version only requires one dose. Health officials say the new vaccine is also what allowed the state to create 3 mass vaccination sites, including one at the Indianapolis Motor Speedway.
What's most important to understand is that all 3 vaccines are highly effective and successful at preventing hospitalizations and deaths. And those are the results we want to see with any vaccine. Hoosiers
with specific comorbidities can also now register to get the vaccine. Those are individuals on dialysis, people with Down syndrome, post-organ transplant recipients, people with sickle cell, and cancer patients being treated now or in the last 3 months. The state's health commissioner says they'll also be expanding that list soon to include more conditions.
I would really be thinking that by mid to late March, we're to 40 and above.
Hoosiers who have comorbidities that make them eligible have to reach out to their primary care providers rather than register for a vaccine appointment through the state. After that, they'll be provided a separate registration link. As for teachers, there's been a lot of pressure aimed primarily at Governor Eric Holcomb to make the vaccine available to educators. But the governor and state health leaders say their age-based approach to vaccine rollout is working, so they're sticking with it, even though President Joe Biden called this week for states to make vaccinating teachers a priority.
It is being driven by data, and we will stay the course, and we will continue our work to reduce hospitalizations and save lives in Indiana.
Indiana teachers younger than 50 are eligible for shots under a federal program being operated at Kroger, Meijer, and Walmart stores.
They're scheduling with those 3 different entities directly with those 3 entities and sites, not 211 and not our website.
Just being able to get the vaccine at a pharmacy is a step in the right direction for teachers.
I know we all want to try to help our students. And it's going to take a coordinated effort among our pharmacies and our educators to make sure that we make this happen.
About 10% of Indiana residents have now been fully vaccinated against the coronavirus since shots first became available to healthcare workers and older residents in mid-December. For more on how vaccines are working in the state, we're joined by Regan Street Institute President and CEO, Dr. Peter Emby. Doctor, things really moving quickly with the state allowing more and more to get vaccinated. What impact will having that 3rd vaccine, the single-shot Johnson & Johnson dose approved this week, to the 2 already available mean for the public?
I think it's critically important. It's going to allow us immediately to vaccinate a lot more people. The new vaccine is highly effective, as are the others, in preventing hospitalizations and deaths. So we're very excited about the addition of that. Not only the additional doses, but the fact that it is a one-time shot is also incredibly helpful for getting out to a lot of populations and being able to vaccinate people who are more vulnerable and getting it out in mass vaccination sites like the ones that were set up this week by the state. So I think it's going to really help us advance and accelerate vaccination, and that's the most important thing right now.
Can you tell how far away are we from anyone who wants a vaccine being able to get one?
Yeah, it's really connected to this other news. I think it's really moving much more quickly than it had been in the last few weeks. So it's looking increasingly like adults should be able to get vaccinated, hopefully by the summer. Right now, the current estimates are that perhaps as early as the end of May, if everything continues on its current pace, we should be able to have enough vaccine for the majority of adults in the country. Realistically, things change. It could push into the summer a bit, but I'm confident with the numbers that we're seeing now that we should be able to hit that target, and that's really excellent. Of course, there's a whole other group of 16 and younger where there are still studies ongoing. And once we have more evidence that it's safe in that population, which I think we all expect will be the case, then we should be able to go into vaccinating even more people.
I know you touched on this, but we're getting a lot of questions about one vaccine being better than another. What's your comment on that?
Yeah, I think it's really hard to compare these to one another. I think the thing that I'm really focused on is right now we have a pandemic. We want to get that under control. And every one of these approved vaccines are highly effective at preventing hospitalizations and deaths. Whether or not there's truly a difference in effectiveness between the one or the other out in the real world, I think will play itself out over time. But comparing the studies to one another is very challenging because they were conducted at different times with different strains and variants out there. So right now, I think we have 3 effective vaccines, and my advice to everyone is get the one that you can get as soon as possible.
We just have just under 30 seconds left. Some states are ending their mask mandates despite only having a small percentage of their populations vaccinated. Is it too soon?
I do think it's too soon. I think that we really need to continue to take precautions. We know that even with vaccination, people can still carry the virus, and we're still learning about this. And frankly, a lot of virus is still out there. So I think we need to be very cautious and not let our guard down too quickly.
All right, Dr. I know you're busy. Thank you very much.
Thank you. My pleasure.